He's a little past 90 degrees. My leg is lengthened. I'm going to pull him onto my foot. Clayton, you dying there?
No, that's good.
It's like going, yeah, I'm only asking the therapist to just dedicate their life to what I'm teaching. I mean, you know, it's not a big deal. What's the problem? It's also such a different foundation for a practice that I think it's unsettling. It's like taking me, I'm a good English speaker. I don't speak Thai. It would take forever to learn Thai. It would take a long time, right? Very different, yeah. Even other Latin languages, French, Spanish, even that are a challenge. It's a little bit like that. If you're comfortable, if you're a massage therapist, you just went through 5 hours of training, or 500 hours of training. They've gotten you comfortable with a certain foundation, and then I come in and go, yeah, just change it. That's challenging for therapists to accept. Toes were outside to prevent him from externally rotating. I'm going to turn the toes in. My toes kind of just under the knee, and I'm going to create a little space here. There we go. His shin is going to cross mine, but I can do this because my leg length. Do you see how we're closer together? Yeah. If I press in here, it's not like I'm pressing in from the side. For the most oomph, I need perpendicular. So I'm going to scoot out just a little bit and big, broad foot press. Big, broad foot press. You dead, Clayton?
Yeah, that's good.
Are you dead? Yeah, that's good. The Thai massage jam was interesting because in Austin, you would take class, this class. Then in Austin, you couldn't go get a job doing what I teach because no facility will hire you because they don't allow mat work. Nah, this isn't massage. So how did I affordably make training and practice the Thai massage jam? You'd come to the Thai massage jam, we'd work with the public, you could give them business cards, you could practice, you could ask me questions, I could work on you, you could work on me. We met every week on Thursday nights for 5 hours. And then massage therapists started to get angry because I was teaching the public. It's like weird. Heel press, foot press, heel press, palm press, finger press. I even gave him a little rock. He said, do that. This leg is mostly just extended. How's the pressure, Clayton?
That's close to the edge.
And I looked at his vibrometer. We've now put the Thai massage jam online using this multicam setup with anatomy. We're trying to get people to participate live, regardless of where they are. Right there. Ooh. Right there.
Okay, so learning, you said we're going to have to learn to feel with our feet yesterday.
Yes.
So what are you feeling that you're able to
Muscle tension.
know? Okay.
When you're in somebody's paraspinals, you got a choice. You could be in the low back, middle back, upper back. Where do you tend to spend more time? Where they have muscle tension. This part of the hamstring felt a little more open. Once I got higher up, I'm like, ooh, that feels a little more dense. Oh, right there. Oh. Feeling, you're going to communicate with them more about the hip replacement. You're going to be a little more cautious, I think, about external rotation. Ask them. So it's one of those things where I tend to defer towards them. I'm like, do you ever have any problems with the hip now? Hip replacements are actually pretty good. Knees, ooh, knees are a little more challenging. But hip replacements, man, dude, they'll go in and saw off that bone and put in a new head of the femur that sticks in the acetabulum and like put a steel plate in that, and it's like, they're like, yeah, we just move the muscles to the side. Just like 2 weeks later, they're like, yeah, I'm taking walks, doing good. Especially if they have had bad problems with that hip that was causing pain. Generally speaking, mobilization, not stretching, and you're gonna test their range. Get them to give you feedback. They're gonna know, oh wait, that's too far, my hip feels like it's gonna start to like pop out of socket. And that's also after they've healed from the surgery, right? Like we know that. How's that, Clayton?
Okay, so a lot of sometimes cause of a hip replacement is the pelvic rotation, which if there's a rotation in some way, I mean, it is easier, replacement or not, for the hip to displace or to, so how are we to be cautious around things like that if we don't
Communicate.
well, what if they don't even know that there's a,
They live in their bodies. I trust that Clayton knows way more about his body than I do. There are certain things you're going to avoid. Let's bring the conversation further, not just hip replacements. With the stuff I've taught you so far, when would you avoid doing this? I can't think of any condition offhand.
That was the only thing that I wondered about.
Yeah.
And
And-
yeah, knee replacement is something.
And am I really pressing on the knee or putting pressure on the knee? Because we're working soft tissue around the joint. There's a lot of stuff,
Loose enough to where it's not uncomfortable here.
and this is going to freak people out. If massage therapists hear this, they're going to be like, a lot of contraindication in my work is a caution. A lot of, like, okay, can you go into the armpit?
Not really. Yeah, you can. I mean, as cold. That's how that is. But dangerous. I got
Tons, and here's what it is. There's tons of important stuff that people need work in their armpit. I go into it all the time. With communication, with me. I'm 44 years old. I've been doing this 20 years. I still go into Google and look up anatomy sometimes because the body is so, once you start digging through layers, tons of complexity, right? If I'm working on Maud and she had a hip replacement and she's like, yeah, this feels, like, oh, okay, this is too much on your hip. I go, Maud, listen, if I take your little leg down like this, does that make, and there's a, oh yeah, because like you were having a little issue with the hip, right? A little shift like that could make a huge difference to how she feels. We're trying to discern, is it muscle tension, like soft tissue, or is it some sort of issue with skeletal structure? What I can tell you is, can I see the controller real quick? And I'll flip this on screen. Let's see what I got here. Not the workbook pages, not the adductors, not the hamstrings, but the femur and the acetabulum. Acetabulum, this makes me feel smart. When you do your YouTube videos on bodywork, you tell them, acetabulum means little vinegar cup in Latin. Acetabulum. It's where the head of the femur sits, and this relates to your question and it relates to your question. We talk about yoga, right? The challenge is when the femur sits in the acetabulum, some people's acetabulum is very deep. And some people's ligaments over this joint are very lax and some are very tight, short. The real challenge is when you have people who do ballet and they have very shallow acetabulum and very lax ligaments, what happens? Joint tends to dislocate more often. In a Iyengar yoga, remember I talked about he mastered the physical yoga and the hatha and this. Even the acetabulum themselves can be in completely different positions on the pelvis. So some people's acetabulum are a little further apart, and some people's acetabulum are super deep, and some people's acetabulum, are you ready, are like this. And this is bony structure. Can we stretch bony structure? And the communication is I'm working around their structure, not having any idea where his femur goes, you know what I mean? Like we know generally, but I don't know. When I take him through a range of motion and mobilize him, it allows me to work on Maud. And I'll show this in a second when I come out of this. Like when I come into his hip mobility, it'll be totally different than what I do with Maud. I had a client tell me one time they wanted me to work on their mom, and they're like, Robert, you can't work on my mom the way you work on me. And I'm like, your mom's 70 years old. I gave his mom a session on a table with a lot of mobility and oil and cream because she's 70 years old. She's got a little thin skin. Dude, she was in love with me. She was like, oh my God, it was the best massage ever. Because I was like, oh, what's going on, Grace? And she's telling me, I'm like, oh, okay, cool, She's telling me about her grandkids or, whatever. I'm still doing the mobilization. The compressions aren't as deep. It's not, I'm going to work on Clayton. I'm going to rough him up a bit. He's a big guy. He got muscles. He wants me to work on stuff. Hey, when it comes to hip replacements, that's why I'm saying communicate with them. We know if they just had the surgery, we can't really do much around it, right? But as far as the soft tissue around the hip, let's say they had a hip replacement, what happens to the soft tissue around the surgery site months later after it's healed? And that's where us as soft tissue people get to come in and work on that stuff. Does it make sense? They can have limitations and restrictions through tons of muscle. Hamstrings, semimembranosus, semitendinosus, biceps femoris, inserts on the ischial tuberosity, right? They can have tons of issues. I kept saying yesterday about the pelvis and how we were taking the red, it'll flash back on in a second, where you're taking the pelvis, the sacrum, the SI joint, you're mobilizing all of that back and forth to access the lumbar spine. Then when you're dealing with muscles around the gluteals, all that stuff is wrapping around the femur. It's wrapping around the hip joint. Then the problem for me as an educator is I'm often trying to find out, okay, what's the problem they're having? And they'll say, well, I had a hip replacement. But that doesn't really mean a whole lot necessarily to the soft tissue itself.